According to the National Institutes of Health, 4 out of 5 Americans will suffer back pain during their lifetime. Dr. Norman Marcus, Director of Muscle Pain Research at New York University School of Medicine, says you have to protect your back to keep it healthy. Good morning.
Good morning, Harry.
It really is common. I mean, really, your phone must ring off the hook, right?
If you don't have back pain, you're abnormal.
You're not the rule, you're the exception, right?
Normal is to have it at some point in your life.
When do you know you should seek help, or when do you know you should call a doctor?
Well, there are what we call red flags. So if you have some swelling, redness, or heat in the area of the pain,
right.
Or if you have a fever,
wow.
or if the pain goes down your leg along with loss of sensation, weakness, and shrinking of the muscles.
Right.
And very importantly, if you lose control of your sphincter, of your bladder and rectum,
then you really need to act.
Then you better go.
Yeah.
Okay. But for the most part, most people are going to be better within a few weeks,
right.
no matter what you do.
That's so interesting, because a lot of people say, I've got to get an operation, and just from what I've read, they're not always so successful.
No, a huge amount of failure. Up to 40 to 50% of back surgeries fail, so much so that we have a new diagnosis called failed back surgery syndrome.
Oh my
And that becomes your new diagnosis.
All right, let's talk about a couple of things people can do on a day-to-day basis so they don't have to wake up with an aching back.
Right.
And one of the things you suggest right off the top is get a good mattress.
That's true. So a mattress that is semi-firm and doesn't show the indentation of your body when you wake up in the morning is very important.
There you go. So that's something everybody can do. The other thing is, and I think this is so interesting, if you're in bed in this new with your new mattress, don't watch TV. How do you mean?
Don't lie down and watch TV or read a book because of neck, shoulder, upper back, or headache pain.
Okay.
And the reason is, if you're holding the book up, that's what we call an isometric exercise.
Right.
And it means you're contracting the muscles.
Right.
Not a good idea.
And so then that all ends up exacerbating in one on top of the other.
Continued contraction of the muscle.
Yeah. Okay. All right. But you can just see somebody like this.
Well, what you can
holding
do is
their head in one place.
Sit up in bed with your back against the headboard, knees bent, where you're not holding the book.
Okay.
And that you're not straining to look at the TV screen.
We like that. Here's one of our friends here in the studio has this in his pocket at all times.
Right.
And that is an invitation to back pain.
Right. You could end up getting surgery, and all it was that the wallet was there, pressing on a muscle which presses on the nerve, the sciatic nerve, that goes down your leg.
Unbelievable.
And that could be mistaken for a herniated disc.
All right. So let's talk about women, because this is a guy thing usually.
Right.
Women, in terms of shoes or whatever, is there a kind of shoe they ought to wear?
Well, a lot of women wear high heels, and there's a certain instability with high heels, but flats are also a problem because it stretches your calf.
Right.
So a lot of women are used to having somewhat of a heel, and a wedge is probably the best.
A wedge is the best one.
Something where your heel is a little bit off of the ground.
And the other thing you say is don't stay in one position. You mean like in driving or what?
In anything in life. The body was meant to move. And, one of the big problems is like the computer. You sit down and you play around on the internet, and before you know it, 3 hours have passed, and you haven't moved a muscle. Well, not moving is not good for the body.
I'll tell you what, if you really want to understand it, go online and look at the central nervous system. And the back, it's like a big switchboard. And it goes to all these muscles down in your legs and your arms and everything else. If you hold that thing in one position, you're surely going to end up with pain at some point.
There it is, doctor.
Thank you very much. Thank you. As someone who's suffered a little, I know a little about it. Thank you so much. That was really good. Dr. Norman Marcus. For more on relieving back pain, all you have to do is log on to our website, earlyshow.cbsnews.com.